welcome to Access Rhode Island. My name is Kate Brewster, and I'm the Executive Director of the Economic Progress Institute and host of this week's program. Healthcare has received a great deal of attention both nationally and here at home, as the Affordable Care Act takes full effect with the implementation of the Health Benefits Exchange, a marketplace where people can purchase private health insurance coverage and often get help paying for it. Here to talk about all things healthcare is Linda Katz, my colleague at the Institute, who co-founded the organization with the late Nancy Gewertz in 1998 and has served as our policy director for the last 12 years. Thanks for being here, Linda. Welcome.
Thank you. Glad to be here.
Let's start by talking about a few very timely, important issues related to healthcare reform in Rhode Island. And if there's time later, we can talk more about some of the general benefits that the Affordable Care Act has provided. Okay. But first, when this program airs on Sunday, December 15th, there will be 8 days left for people to enroll in a health plan through HealthSource RI, which is our health benefits exchange, right, if they want to be covered by January 1st. There'll still be time to enroll after that, but for January 1st coverage, you've got to enroll by the 23rd of December. Correct. So, can you remind people, let's just talk generally about the types of coverage that are offered through HealthSource Rhode Island.
Okay, and you're correct that in order to have coverage by January 1st, people have to enroll by December 23rd, but the open enrollment period for the commercial insurance will be through the end of March. Okay. So through HealthSource Rhode Island has, you can think of it as sort of probably three parts. One part is there's an individual marketplace where individuals can purchase health insurance coverage, and there are 12 plans offered on the individual side that are offered by two different carriers. Neighborhood Health Plan, which now for the first time is having a commercial product. That's Neighborhood has been the premier one of the two managed care plans that provide coverage to people in the RIte Care program, along with United Healthcare. In the individual market in the exchange, it's Neighborhood and Blue Cross that are offering health plans. And then there is also a small marketplace for small employers, and Rhode Island is a leader in the country in offering small employers a new opportunity for full employee choice, where employers can determine how much they want to pay towards their employees' coverage, and then employees will be able to choose from one of the 12 plans in the marketplace. So that's a real innovation for Rhode Island, and we're going to see how that pans out. Then the third way of thinking about HealthSource RI is that that's where people can go to apply for coverage and have a determination made about whether they're eligible for help paying for health insurance. And that can be the Medicaid program, or it can be tax credits that will be offered for people who are not eligible for Medicaid but have lower income and will get help from the federal government to purchase their health insurance coverage.
Terrific. And generally you go on to one website, punch in your information, and it's going to kind of drive you to the correct place, in theory.
Right, which is a real innovation for the Medicaid program as well, as that has been a paper application process for years, with people having to submit paper documentation, so for pay stubs, for example, and proof of pregnancy if somebody's applying because they're pregnant. And now with the new it's really a sort of a separate eligibility system that's not just HealthSource RI, because you can access that eligibility system through the EOHHS website, the Executive Office of Health and Human Services, and the Department of Human Services website, and that is sort of one-stop shopping for determining eligibility for Medicaid or for the tax credits that will help higher income people pay for commercial health insurance coverage.
Which is exciting to have all this change.
It's a big change, and it should make access to coverage much easier. There, it's some glitches in terms of the application process right now, but over time it's really tremendous in that people are not going to have to fill out papers anymore. They won't have to go and scrounge for their pay stubs and things like that.
Great. So let's start by talking about Medicaid. And it's now being offered to adults who do not have children for the first time. Many of them, we suspect, are out there and eligible. First, I would just ask, maybe just clarify between Medicaid and Medicare, because you always hear people talk about those interchangeably. Right. Okay. So what's the difference between Medicaid and Medicare?
So Medicare is insurance that is provided for individuals who are elderly and for people who are disabled and have been receiving Social Security benefits for at least 2 years. So it's a national program. It's based on people getting Social Security benefits. It's sort of our single-payer system for elderly people and people with disabilities.
So Medicare is for the one when you turn 65 or 7 or whatever it is
Right.
now. Medicaid is?
Medicaid is a sort of welfare-based program in that it is dependent on people's income. And until now, it's also been based on sort of a category. You had to either be elderly, disabled, or a parent, pregnant woman, or a child to qualify for Medicaid, to come in the Medicaid door, and then your income had to be within certain limits. And what the beauty of the ACA is, the Affordable Care Act, is that it had planned to set Medicaid as sort of the floor for everybody, regardless of what they looked like. You didn't have to be a child or a pregnant woman. As long as your income was below 138% of the poverty level, you would be eligible for Medicaid. And that was undermined a bit by the Supreme Court decision that let the states decide whether or not they wanted to participate in the Medicaid program. Rhode Island happily, that was in the governor's budget, to say that we would exercise that option. Makes a lot of sense because it's free for the state for the first couple of years. There's no cost sharing for the state to cover people. And the estimates are that there are 45,000 Rhode Islanders with income less than $16,000 a year who are newly going to be eligible for Medicaid. So it's a tremendous boost in terms of helping to reduce the number of uninsured people in Rhode Island.
Terrific. I mean, 45,000 is a lot of people.
It is. You know, it's people who are working as waitresses, who are working as short order cooks, who are washing dishes, people who have not had access to coverage through their employer, or maybe they've been offered coverage through their employer but not able to pay for it.
Right.
So $16,000, not a whole lot of money. Still tough for people to get by, but now if they will be able to get free health insurance
And
coverage.
we know so far at least 3,500 people have signed up for Medicaid, is that?
Yeah, about 3,500 have come in. And we also know that there's about 15,000 people who are getting SNAP benefits who are potentially eligible for Medicaid in this expansion group. And we're hoping that the state is going to exercise an option that the federal government has made available to be able to just sort of automatically enroll some of those folks. They will choose to enroll, but it'll be a very simplified application process. And if we do that, we'll see another 15,000 people sort of come into insurance pretty easily.
Great. So a cornerstone of the Affordable Care Act, which we've heard a lot about, is that individuals and families are eligible for, can be eligible for tax credits that will help them pay for the coverage. Can you talk a little bit about how the tax credits work and the incomes at which, and we'll start with an individual might be eligible for?
Sure. So for an individual, their income can be as high as $46,000 a year, and they would qualify for a tax credit that would help them pay for their monthly premium. So the way the tax credit works, if we want to do an example, let's think about Jill, who's a waitress. She's 40 years old. She's never been able to afford health insurance coverage. To buy coverage through the exchange, a plan that's sort of in the middle tier called the silver tier, where there's sort of a balance of out of what the premium would cost versus out-of-pocket expenses like deductibles and paying for co-payments for doctor's visits and for prescriptions. A plan would cost her about $175. I'm sorry, the plan would cost her $332 a month. She's eligible for a tax credit of $175 based on her income, and so she could buy that silver level plan for $157 a month. So she's basically getting more than half of the plan subsidized through a tax credit.
She will have some cost sharing or co-pays, as you said.
Right. She would still have to pay, just as we all do in sort of our plans, some co-payments when she goes to see the doctor, or co-payments for her prescriptions, and there is a deductible. But with income below with income below about $29,000 a year, if her income, she she would also be eligible for some cost-sharing assistance to help mitigate some of the out-of-pocket costs that she has. So there's really sort of two tiers with help for folks. For individuals, if income is below $46,000 a year, they can get help paying for their premium. If their income is below between $28,000 and that $46,000, they can get help with their out-of-pocket costs. And then if their income is below $15,000, they get Medicaid coverage.
Right. So a good reason to go to HealthSource RI and put yourself through the system to figure out which tiers you may be eligible for. Well, at this point, and we'll talk about families in a minute, at this point, let's talk about people are watching and saying, oh, that might be me. Where can people go? There's been a lot of assistance set up in the community and in the state to help people get through this process. So where can people go to get help applying? I mean, you can do it at home through the website, healthsourceri.gov. Is that right?
.com.
.com. But where else can people get help?
Well, let's just start with the website. So if people do go on the website, and start the application process and they get stuck, they can call the contact center for help, and they can also go to the contact center, which is located at 70 Royal Little Drive in Providence, and sit down with a person there at the contact center who will help them walk through the application process. In addition to the contact center, there is a network of navigators, and there's about 138 of them now.
Wow.
The Rhode Island Health Center Association is the manager, the navigator manager, and there are navigators at all of the community health centers around the state, and also at a number of community organizations, including the Mental Health Association of Rhode Island, Amos House, the Center for Southeast Asians, Family Resources Community Action Program up in Woonsocket, John Hope Settlement House, United Way, Latino Public Radio actually is a navigator, and they've been doing a lot of outreach on the radio to inform people about new coverage, and they have staff who can help people do the enrollment process. Also Providence Community Library, Providence Center, and the Narragansett Indian Health Center, and then Care New England, the network of hospitals that includes Butler, Kent Memorial, and Women and Infants. They have navigators on site to help people enroll as well. So if people are looking to meet with a navigator, what they would want to do is go on the HealthSource RI website, and if they can find the list of navigators, and they can actually put in information to say, I'd like to meet with a navigator in this area of the state. If they can put in the language, because navigators speak languages other than English, and they can actually also pick a navigator if they'd rather see a woman or a man. They can indicate which gender person they'd like to meet with. So it's an interactive tool where they can actually identify the people who the navigator is in their area, and they can call them and set up an appointment to meet with them.
Great. What about the Department of Human Services? Are they still involved at all, or?
So yes,
that's what many people are going to be used to contacting.
Sure, and the DHS staff at the DHS offices now, there are portals that people can use to apply for coverage through the online system, and there are staff that can help them do that. I don't believe that people can set up an appointment at DHS to go through the whole process, and they're focused mostly on the people who are going to be Medicaid eligible, and not so much on the people who are going to be eligible for subsidies when they buy commercial insurance.
Right. But lots of help out there for folks if they need it, which is great. So let's talk about the RIte Care, some stuff that happened in the legislative session with respect to RIte Care. One of the unfortunate outcomes in June when the General Assembly passed the budget was that they did eliminate approximately 6,500 parents who are currently enrolled in RIte Care. That will take effect on January 1st of the coming year, so in just a couple of weeks. The thought was that parents who had income at certain levels who are getting RIte Care could then enroll in the exchange. We were concerned and voiced concerns that this was not going to be affordable or as affordable as it had been for these families, and that it's great to have parents and children all enrolled in the same plan. It makes life a lot easier. So as of today, many families actually are receiving notices telling them that they will no longer be enrolled in RIte Care, and that's probably quite distressing for folks. What is happening with these families or these parents?
So as you mentioned, the parents have received a notice that at the end of December, they're no longer going to be eligible for RIte Care. What EOHHS and Neighborhood Health Plan and HealthSource RI, the exchange, have worked out is that the parents can be automatically enrolled in the neighborhood commercial program called Neighborhood Value, so that they would have coverage effective January 1st. And the state will pay the parent's share of the premium, so there'll be no out-of-pocket cost for the parent to have that coverage in January. And if we look at an example for the parent, so if we think about a parent with 2 children whose income is about $27,000 a year, that's the parents at sort of the lowest income parents who are losing their health insurance coverage. And again, thinking of an example, for that parent to buy a plan through the exchange would cost $280 a month, but the tax credit that parent is eligible for is around $206. The state is going to assume that the parent will get that tax credit. They're going to use the income that they have in their records at EOHHS and say, based on this income, we think the tax credit's going to be about $206, so the parent's out-of-pocket would be $74. For January, the state is going to pay that $74, and the parent will have coverage through Neighborhood Value. The parent will then, in January, need to go through the full application process online, and the plan is for there to be a lot of outreach to those parents to help walk them through the process, whether that's a navigator that's going to help them or the contact center that will help them, because going forward the parent's going to have to decide, do I want to stay enrolled in coverage? Can I afford the premium going forward? And do I want to stay in neighborhood, or do I want to switch to Blue Cross, which is the other carrier?
And just not to interrupt, but I'm going to interrupt. These folks weren't paying anything out of pocket before.
Right.
So now we've got a $74 premium that they'll have to pay in February, and we've got out-of-pocket expenses.
Well, yes, with the caveat that when the General Assembly rolled back the parent eligibility, they did 2 other things. They said that there would no longer be any premiums for RIte Care coverage for families and kids, which is great, because that means that for all families that are getting RIte Care for their children, and the children's eligibility goes up to 2.5 times the poverty level. So parents will no longer have to pay for their children to have RIte Care coverage. The second thing that they did was to create a state premium assistance program. So actually, going back to that example, the $74 that the parent would have to pay a month, the state will continue to pay $49 of that $74, and the parent would have to pay $25 a month.
Well, that's better.
Instead. So that's better, although you're right, that parent at that income level, we have never expected that parent had enough money in his or her budget to pay a monthly premium for RIte Care. So the $25 for some families is still going to be a stretch. And the challenge is going to be working with that parent to see who has had health insurance, so they understand the benefit of it. This is why you should continue to find money in your budget to pay for health insurance coverage. You know how important that is. And we certainly expect that parents who have a disability or any kind of chronic condition are going to prioritize finding that $25 so that they'll continue to have health insurance coverage. You're also correct that what's also going to be different for these parents is that in RIte Care, you don't have to pay when you go to the doctor or to pay for a prescription, and with commercial coverage, these parents will have those costs as well. So we're going to be monitoring very closely to see what the impact is for these parents, to see whether A, they enroll in January, and secondly, whether people, they stay enrolled and whether they actually go for care.
What advice, if anybody's watching now, they've got their letter,
Right.
what advice would you give people in the next couple of weeks?
So by the time this airs on December 15th, hopefully parents they had been offered the ability to opt out of being automatically enrolled. Hopefully the parents have not opted out, that they have stayed in, but then in January, the most important thing is that the parents who are automatically enrolled in neighborhood value call somebody to do the application process online. And especially for the lower families with lower income, some of those parents are still going to be eligible for RIte Care, and that because there are new ways of counting income. So families that are near $27,000, $28,000 a year in income, families that have child support, which is counted under the current rules but is not counted under the new rules.
Which is probably a significant amount of income for many parents.
Right. People who claim tax, who are supporting other family members and are tax dependents, again, because of these new rules, there are some parents who will be eligible for RIte Care, and will get on RIte Care again beginning in February. So it's very important for people to go through the process.
And there's also another element, you've talked about this a little bit, but people have to be sure to enroll in the correct plan in order to be able to get the tax credits. So you don't necessarily want to go for the cheapest plan in terms of monthly cost, which might be the natural tendency. No?
Yeah, well actually,
I should know this.
With you can use your tax credit to enroll in any plan, so you can sort of buy up to a plan that has a lower premium, I mean higher premium but lower out-of-pocket costs, or buy down to a plan that has a lower premium. What you can't, if you buy down, then you can't get the cost-sharing subsidies and you can't get the state assistance. So people want to stay in that silver level tier of coverage because that's the only way they'll get help paying with the out-of-pocket costs and help getting the state assistance that will help pay for their premium. So obviously a lot of very confusing information for folks.
My head hurts.
The bottom line advice is for the parents who are automatically being enrolled in RIte Care in neighborhood value for January is to go through the application process in January so that they can see their options for February, and that they will get some personal assistance to help them understand what is a pretty complicated process.
Right. Woof. Well, moving on from that, and we know you've done a lot of work on that, and we appreciate all that you have done to try to make this as smooth as possible. Certainly nationally, Obamacare, as people love to call it, has suffered some public relations blows with the troubles that the website has had.
Right.
And hopefully that things are being fixed. What we don't talk enough about is some of the other benefits that the Affordable Care Act has offered families. So let's just talk a little more broadly about what other great benefits we've seen through this plan.
Sure. A couple of things. A primary thing is that people who there are many people who have pre-existing conditions and have not been able to even buy health insurance coverage. I mean, it hasn't been offered to them. So we've kept sick people out of the marketplace. Under the Affordable Care Act, it's everybody into the pool. So as of January, people cannot be denied coverage because they have a pre-existing condition. And once they're in coverage, people cannot be told that they're going to have limited amounts of coverage because they become sick. So it's really critical coverage for everybody across the country. Another feature is that young adults can stay on their parents' health insurance coverage until they turn age 26. In Rhode Island, we had a law that provided that young adults could stay on coverage till age 26, but only if the young adult was in school. I personally have benefited from this. I have a daughter who's 20, and Without the Affordable Care Act, she's working, she's not in school, we would have had to buy separate coverage for her, which would be much more expensive than continuing to cover her through a family plan. In addition, preventive care is emphasized through the Affordable Care Act, so there are no co-payments when people go to a doctor for the preventive care visit, as well as some tests, mammograms and different diagnostic tests are also provided without any kind of copay. So for elderly people, seniors and people with disabilities who are on Medicare, they have had to go without some prescription coverage called the donut hole. That donut hole is shrinking over the years so that eventually people will no longer have to go out of pocket for their prescription coverage. So there's a lot of pieces of the Affordable Care Act that sporadically get covered in the newspaper or on the TV, and it's really a shame that the problems with the website have sort of overshadowed the whole structure of the Affordable Care Act and all of the benefits that are provided to folks.
And people will probably quickly take them for granted and forget, that there were pre-existing conditions, but so important for so many people who have been very sick.
Right.
And I just want to go back, Rhode Island really did benefit from the expansion of Medicaid. Many states opted not to expand Medicaid, so you could be living in one state and be eligible and living in the next state and not. And that was a real unfortunate outcome of the law and the Supreme Court decision, as you said.
Right.
So,
yes, the politics have gotten in the way of logical thinking and benefits for residents of states. So there are more and more states that are coming online. I think as they realize what they're foregoing by not expanding Medicaid, and hopefully that will be something that we see become universally available.
Right, and not all states created their own health insurance exchange.
Correct.
So this has been the problem. People are using the federal exchange, but Rhode Island's actually done quite well in terms of its computer system, website, and all systems really were a go on the start date. And we've been kind of hailed as a national leader, which is terrific.
Right. It is, and it's not that we haven't had glitches in terms of our own system, but Rhode Island has a team of people and is able to address those systems on a very rapid basis. And so when I think about what's happening at the federal level, where they're trying to deal with 26 or more states to figure out all of the health insurance products that are being offered in those states and figure out the eligibility, it's just really overwhelming. Because even in Rhode Island, it's, you create something new. Whenever you create a new technology like that and do such a big undertaking, there's bound to be issues that come up as people start to use the system. So whether it's volume that then gets addressed, or it's just fixing individual issues as people are going through the website, Rhode Island's very fortunate that those things have been solved very rapidly.
Right. So we've got 30 seconds left.
Okay.
I just want to remind people that if they need health insurance, they should visit healthsourceri.com. They can call the contact center. They can seek help at one of the navigators. And certainly if parents are watching and receiving letters telling them that they will no longer be enrolled in RIte Care, they should not opt out of their health insurance and neighborhood health plan for the next month, but stay in and then be sure to follow up and go through the process of applying through HealthSource RI to see whether they may be eligible, continue to be eligible for RIte Care because of some changes, or if they are in fact eligible for tax credits and cost sharing and will be able to get on a path towards private coverage. So I want to thank you for being here. Of course, I didn't give you much choice.
Always a pleasure to be here.
Wish everybody a happy and healthy new year. Thank you.